So we're just following up with Chris. Today's going to have his third Shockwave session, but he had a second last week on his left side, which was been the most problematic since he was like 17. He is going to share with us how he felt after his second Shockwave and over the weekend, and then how he felt when he came in today, and then how he feels right now after his third session. So go ahead, Chris.
Okay, so after the second session, it was a couple days later, I went out and ran up a hill, like 5 miles up and back, a total of 10 miles, but the out portion is essentially, it's like 1,455 feet of elevation gain. And the hips that we've been working on, when we started, I felt it a little bit, kind of went away, and felt pretty good running, coming down the hill, obviously a little bit faster, but afterwards, noticed that the recovery time was much quicker than it had been recently, which usually the hips are kind of tender for several hours, and I didn't have any feeling like that at all. It was kind of like it has been maybe 10 years ago or so when you're a little bit younger. So that was nice. And then today we were just working on maintenance, and then a spot where there's a spondy, which has been a challenge, and we'll give another day or so and see how that feels.
So let me ask you this. Do you remember last week, I could probably go back in the video, but before your second session, what your pain on your left hip was? Or was it only when you ran that you felt it?
More or less, it's when I run, because it puts more pressure on it. But there are times, and if I'd have run like that, the hill like that, I would have some discomfort for a couple of days. I mean, tolerable, but you would notice it, and I haven't noticed anything.
So did you notice you had less discomfort when you started the hill in addition to quicker recovery?
Yes.
Okay, great. Could you put a number to that? Like 20%, 50%?
It's probably, I would say it's between 30 and 40%, because you know, it's a number, as you said, I was pretty young when I first started having issues, and I've learned to tolerate that, but it was an improvement.
Yeah, this is the most dramatic improvement of something that we've done for you that you've felt, right?
That's correct.
Now, when you came in today, what was your pain, soreness, stiffness level when you first came in? Did you have one?
Not really, no. I mean, the soreness that I had nothing to do with my back. It was my quads, because I ran down hills.
Okay, so even after that run, which you said you haven't done in 10 years?
Several, 2 or 3.
2 or 3 years. You don't have any side effects or repercussions from it?
No, not in the areas that we were working on.
Okay, and right now, since you didn't have pain when you came in, is there anything you can notice different? You say it's freer, less tension, lighter?
I felt the last couple of days when I ran, my legs felt freer. I mean, I guess I would say it was more relaxed, but it felt like things were more fluid than they have been.
Okay. And what about right now after this session? Do you feel any different? And you don't have to.
It's way too early to tell.
It's okay. Yeah. We're just doing this for documentation purposes, and maybe for people that can relate to the conditions that you're having, and see if it might help for them if they're struggling to find answers. So awesome. So we're going to track you through. This is our third one. Well, second one on the left hip, which is pretty good results. Just 2, or just 1 actually, because we don't know how this is going to turn out. But today was the third total. 1 on the right hip, low back, 2 on the low back, and 2 on the left hip. And then next week we'll figure out what we're going to do from there.
Okay.
All right, Chris, have a happy 4th.
Thank you. You too.